Good morning, everyone. Before we begin our presentation, allow us to introduce ourselves. My name is Mary, and my friend is Anthony. We are going to talk about the diagnosis of blood abnormalities in connection with diabetes mellitus. There are 10 points we are going to discuss. I am going to discuss point 1 until 3 and point 7 and 8, and my friend Anthony is going to talk about point 4 until 6 and point 9 and 10. Diabetes mellitus, the 9th leading cause of death globally, is connected to the hospital load. Hospitals often have a big number of diabetic patients seeking diagnosis, treatment, and care. Point 1 is the definition of diabetes mellitus. Diabetes mellitus is defined as a metabolic disorder in which the body's ability to produce or respond to insulin is impaired, resulting in elevated blood glucose levels. Point 2 is the types of diabetes mellitus. There are 3 types of diabetes mellitus. Type 1 diabetes is an autoimmune condition where the pancreas can't produce insulin and requires lifelong insulin therapy. Type 2 diabetes is a metabolic disorder due to insulin resistance and insufficient insulin production. Gestational diabetes occurs in pregnant women due to hormonal changes affecting insulin production, resolves after birth but increases the risk of type 2 diabetes later. Point 3 is the signs and symptoms of type 2 diabetes. There are several signs and symptoms of diabetes mellitus, such as increased thirst, polydipsia, increased hunger, polyphagia, unexplained weight loss, fatigue, increased urine output, polyuria, blurred vision, slow healing, and numbness. Now my friend Anthony will continue the presentation.
Thank you, Mary. I am going to talk about point 4 until 6. Point 4 is the risk factors of diabetes mellitus. There are 2 risk factors of diabetes mellitus. The first is modifiable risk factors that we can change, like weight, physical activity, and healthy lifestyle choices. The second is non-modifiable risk factors that we cannot change, like family history, age, ethnicity, and gestational diabetes. Point 5 is the treatment of diabetes mellitus. Type 1 diabetes mellitus can be treated by insulin injection. Oral medications can treat type 2 diabetes mellitus. Lifestyle modifications can also treat diabetes, like a balanced diet with controlled carbohydrate intake, physical activity like regular exercise to help lower blood sugar levels, and improve insulin sensitivity, and weight management to achieve a healthy weight. Point 6 is the diagnosis of diabetes mellitus. Type 2 diabetes can be diagnosed by hemoglobin, A1C, HbA1c test, fasting blood sugar test, oral glucose tolerance test, and random blood sugar test. Now my friend Mary will continue the presentation.
Thank you, Anthony. I am going to talk about point 7 and 8. Point 7 is magnetic resonance imaging, MRI. MRI is commonly used to evaluate and detect complications associated with diabetes mellitus, such as diabetic nephropathy and diabetic retinopathy. MRI provides detailed images of the organs and blood vessels, helping to identify abnormalities. Point 8 is ultrasound. Ultrasound imaging is frequently used for assessing blood flow and organ structure in patients with diabetes mellitus. Ultrasound is very useful for examining blood vessels and detecting vascular abnormalities. Now my friend Anthony will continue the presentation.
Thank you, Mary. I am going to talk about point 9 and 10. Point 9 is computed tomography, CT, scan. CT scanning may be employed to identify blood vessel abnormalities, especially in the case of peripheral arterial disease, PAD, in diabetic patients. CT scanning provides detailed cross-sectional images of the body, aiding in the detection of vascular complications. Point 10 is Doppler ultrasound. Doppler ultrasound is a specialized form of ultrasound that evaluates blood flow in the vessels. Doppler ultrasound can be used to assess blood flow abnormalities and detect peripheral arterial disease in diabetic patients. That's all about our presentation, and thank you for listening.